Well, I think we're rapidly moving towards opening up the country. It's going to happen extremely fast over the next few weeks. So, yeah. So something that would be helpful just to add from an informational level is when reporting sort of COVID cases, to separate out diagnosed with COVID versus had COVID-like symptoms.
Yes.
Because the list of symptoms that could be COVID at this point is like a mile long. So it's like hard to, if you're ill at all, it's like it could be COVID. So just to give people better information, definitely diagnosed with COVID or had COVID-like symptoms. We're conflating those two so that it looks bigger than it is. Then if somebody dies, was COVID a primary cause of the death or not? I mean, if somebody has COVID, gets eaten by a shark, we find their arm has COVID, it's going to get recorded as a COVID death.
Is that real?
I mean, basically.
Not that bad, but heart attacks, strokes.
You get hit by a bus.
Cancer.
If you get hit by a bus, go to the hospital and die, and they find that you have COVID, you will be recorded as a COVID death.
Why would they do that, though?
Well, right now, the road to hell is paved with good intentions. I mean, it's mostly paved with bad intentions, but there's some good intention paving stones in there too. And the stimulus bill that was intended to help with the hospitals that were being overrun with COVID patients created an incentive to record something as COVID that is difficult to say no to, especially if your hospital is going bankrupt for lack of other patients. So the hospitals are in a bind right now. There's a bunch of hospitals they're furloughing doctors, as you were mentioning. If your hospital's half full, it's hard to make ends meet. So now you've got if I just check this box, I get $8,000. Put them on a ventilator for 5 minutes, I get $39,000. Or I got to fire some doctors. So this is a tough moral quandary. It's like what you can do. That's the situation we have.
Ugh. What's the way out of this? What do you think is like if you had the president's ear, or if people wanted to just listen to you openly? What do you think is the way out of this?
Let's clear up the data. So, like I said, something should be recorded as COVID only if it is somebody has been tested, has received a positive COVID test, not if they simply have symptoms, one of like 100 symptoms. And then if it is a COVID death, it must be separated. Was COVID a primary reason for death, or did they also have stage 3 cancer, heart disease, emphysema, and got hit by a bus? And had COVID.
Yeah, I've read all this stuff about them diagnosing people as a COVID death despite other variables.
This is not a question. This is what is occurring.
And where are you reading this from? Where are you getting this from?
The public health officials have literally said this. This is not a question mark.
Right. But this is unprecedented, right? Like if someone had the flu but also had a heart attack, they would assume that person died of a heart attack.
Yes.
Yeah. So this is unprecedented. Is this because this is such a popular, I don't want to use that word the wrong way, but that's what I mean, a popular subject and financial incentives? Yes.
And like I said, this is not some sort of a moral indictment of sort of hospital administrators. It's just they're in a tough spot here. They actually don't have enough patients to pay everyone without furloughing doctors and firing staff, and
yeah,
they're potentially going bankrupt. So then they're like, okay, well, the stimulus bill says if we get all this money, if we say if it's a COVID death, I'm like, okay, they coughed before they died. In fact, they're not even diagnosed as COVID. They simply, if you had weakness, a cough, shortness of breath. Like, frankly, I'm not sure how you die without those things.
Yeah.
Yeah.
Right. There's so many different things that you could attribute to COVID too. There's so many symptoms. There's diarrhea, headaches, dehydration,
Yeah,
cough.
Yes, but to be clear, you don't even need to have gotten a COVID diagnosis. You simply need to have had one of
Yes.
many symptoms and then have died for some reason, and it's COVID. So then it makes the death count look very high, and then we're then stuck in a bind because it looks like the death count's super high and not going down like it should be. And now, so then we should keep whatever, keep the shelter in place stuff there and keep people in their home, confine people to their homes. So we need to break out of this. We're stuck in a loop.
Yeah.
And I think the way to break out of this loop is to have clarity of information.
Clarity of information will certainly help, but altering perceptions, public perception from people that are basically in a panic. There's a lot of essentially, well, at least a month ago, we're clearly in a panic. I mean, right where, when you look around April 5th, April 6th, people were really freaking out. Mm-hmm. But here we are, May, and May people are relaxing a little bit.
Yes.
They're realizing like, hey, I actually know a couple of people that got it. It was just a cough. And I know some people that got it where nothing happened.
I know a lot of people who got it. I know 0 people who died. I mean, I know a lot of people who got it.